of all the things that I'm going to teach you, burns scare me the most. They're horrible. I've worked in the burns unit and I've seen little children and I've seen them melt.
Poor 3-year-old that's burnt.
Yeah. So with burns, what you do makes a huge, huge difference. So if you can, or rather if you've got a little one that is in a coffee shop and hot liquid or hot coffee is spilt over them, what should you do first? Should you take the clothes off or leave the clothes on?
Leave them on.
Yeah.
I think if the clothes are burnt onto the skin, but it wouldn't necessarily happen in a coffee shop. I need to leave them on, and then if you can take it off.
It depends.
Okay.
It depends is your answer. If they have a few layers of clothes on and the coffee wasn't piping hot just made, then if I can, I would get the clothes off as quickly as I possibly can.
Okay.
Because this will retain an awful lot of heat, and getting this straight under cool running water, I can cool it far more effectively than trying to cool it through the clothes. If, however, it was caused by anything other than hot liquid, then the clothes will actually burn into the skin, they'll become part of the skin. Or, if they were wearing a flimsy little baby grow like this and piping hot coffee was spilt on them, that skin will burn and blister almost immediately. If it blisters, it will stick to the clothes. If it's stuck to the clothes, then when I come to take them off, the skin will come too. The other important thing is check all over for anywhere else where that hot liquid might have gone, because you want to treat burn at the same time. So we had a situation the other day where someone had hot liquid hot coffee spilt over their arm. They were treating the arm and didn't realise that they had little Ugg boots on and the hot liquid had gone in there as well.
Oh.
So look all over and make sure you're treating it. Now you're treating the burn, but not the child. You're cooling the burn, but not the child. So keep the child warm. Wrap them up in something, and you want to prevent them from being cooled too much because of shock. So what you would do is straight under cool running water. Cool, 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 and cool some more. The other thing is, don't be tempted to roll the sleeve up to cool the burn, because you'll probably find that this bit's fine, and then when you come and have a look, it's burnt all the way around there. Burn all the way around there will actually constrict the blood vessels as it swells, and you can lose the blood supply to the limb. So just make sure you have cooled it all over, but if you're taking the clothes off, then you take them off completely, and you look all over to see where it might have gone. Okay, so cool, 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 and cool some more. Burns to the hands, the feet, the genitals and the airway are the most serious, as are burns that go all the way around a limb. That is 1% of my body. That is 1% of theirs. So a burn that is the size of a 50p piece is hugely serious for a little one. So when you are assessing how serious it is, if it's a red area or a blistered area and it's that sort of size, keep under cool running water, and I would be phoning an ambulance. Get the paramedics to come to you while you are still treating the burn, particularly as it is not your child. Burns scar and burns are nasty. Now, treating a burn properly in that first instance can make a huge difference. You can reverse a lot of the damage that has been done. I was being told it, I didn't really believe it. My husband burnt himself because I had put on the oven. He didn't realise, he went to grab an oven tray, he got it out, he burnt himself right across the middle, it blistered straight away. I apologised profusely, I put on cool running water, made him put his hand straight under, grabbed him a chair, put the oven timer on for sort of approaching 15 minutes and made him sit there. So he just sat there under cool running water. At the end of that time, the burn had gone, the blister had gone, and there was no sign of any damage.
Wow.
If you cool a burn properly, you can reverse it. And even quite nasty burns, when they are screaming blue murder and you are fighting with them to hold them under cool running water, you can make a real difference in having that fight. And burns hurt. Okay, in terms of dressing a burn, in the book and in various other places they talk about dressing it with cling film. If you are dressing a burn, what you are doing is covering the nerve endings and reducing the pain, which is sensible. And you're also reducing the risk of infection. If you are putting cling film on a burn and you haven't cooled it for at least 20 minutes, then if you were to wrap cling film around, you will just poach. So if you are treating somebody else's child, I would honestly advise you to keep under cool running water and to get an ambulance, get the paramedic to come and treat and see it properly and assess it. It's not your child. If you have a stubborn adult who doesn't want to get the paramedics out, then you get them to cool it under cool running water for at least 20 minutes and then get a small bit of cling film that you would put over the affected area, and then you would put cold wet towels over the top. It's not ideal, but it's the next best thing.
You know, you're saying like with the ice pack and getting burnt, if you have like too cold water?
Yeah, cool running water. So, what it will do is it will constrict the blood vessels and actually slow down the...
It can never be too cold?
No, you don't want it too cold.
Okay.
So cool running water is what you want. So take the very edge off the freezing cold. Okay. If you've got proper burns dressings, same as the lady in the bombings had on her face, they can be very effective at taking the burning away. So if you are able to use those, the advice from the plastics units are still to give it the best possible chance. You cool for at least 10 minutes under cool running water before you are using one of these.